Hi, I'm Colin Hung with Healthcare IT Today, and I'm excited to sit down with Renee DeSilva, who is leader of the Health Management Academy. Renee, welcome to the program.
Hi Colin. Thanks for having me.
Yes. Now, we were just commenting before. This is kind of like a role reversal for you,
Yes.
right? You're the one asking the
I'm used to being
question.
in the other chair,
Okay.
but I like it.
I have my challenge cut out for me, is what you're saying.
I'll be nice.
Okay.
I'll be nice.
Well, before we get deep into talking about what I wanted to ask you
Yes.
about, can you give our audience a little bit of a background about your organization?
Sure. Well, I, for many years, have been on the talent development side and have loved the power of conversation to move change forward. And so the Health Management Academy platform is designed to do that. We work with leading health systems, so defined as top 150, $3 billion in operating revenue or greater, and industry companies to have small, curated conversations to get at the heart of challenges in healthcare and think about how collaboratively we might be able to move that along.
When you say small collaborative conversations, what do you give us an
Yeah,
idea
what does
of
that look like?
Yeah.
So I'll give you a real example. Last week we were in California with a group of chief financial officers, about 30 health system CFOs, about 45 industry companies, so 150 people in the room. We had a group of fellows, so folks that were going through a leadership development training program on how to be the next generation of chief financial officers. And we had small conversations around how do we think about getting back to black on margin, how do we think about integrating technology into care delivery, but in very small, peer-generated, informal conversation.
I like how it's not just for people who are in the role, but for people who are up and coming,
aspiring to. Yes, yeah. I mean, it goes back to that, for any of our companies, we are one generation away from losing ourselves, right? And so if you're not investing in the bench of people who are coming up behind you, you sort of have a missed opportunity. So we spend a lot of time at the Academy on various fellowship programs and partnership with folks like GE Healthcare and AWS on the technology side to really figure out how do you get the next generation really ready to sit and to ascend and to manage the business and the people side of healthcare.
So given your unique perch in the marketplace and in the ecosystem, you get a chance to talk to and converse with a lot of the health leaders, as you said, the top 150. What are some of the things that you're hearing in terms of technology? What are some of the hot trends and the priorities that you're hearing about?
So a big part of what the Health Management Academy does is we listen. So we have about 65 live events a year. We have 2,000 executives flowing through our doors. We listen and then we try to curate that into insight that the rest of the industry can take. So recently we did a survey among our IT audience, and that would include technology, CIOs, Chief Medical Information Officers. 3 big issues that are animating with that group. One is how do we think about clinical workflow redesign with AI and automation being a key tenet of that. And if you look on the floor here at Vive, a lot of companies are anchored in that space.
Sure.
The second was around how do you really think about integrating in this sort of human technology dyad model of care, right? Like figuring out what should be automated, what shouldn't be. And then the third is like far less sexy. It's cyber, it's business continuity, it's how to make sure that we have some make sure that we are not brought to our knees by just cyber attacks. And I think those are the 3 big issues that most IT leaders and broader C-suite leaders are really focused on right now.
Well, it's definitely not sexy, but I would say if you talk, it's very important. I was going to say the cybersecurity angle especially, we've been hammered on that over the last 5 years, and it's nice to see it's still a priority right now for
Absolutely.
folks. Anything bubbling under though? Is there anything that's kind of like, you're looking at going, wow, it's like that's going to be the next?
I think that the big one, and it's probably in that sort of first bucket of what can be automated, it would be, there's been a lot of focus on digital, but maybe a time to think through an expanded framework. It's less about the digital front door, maybe it's the digital house, the digital highway. We recently did a study that looked at 14 different capabilities of what does it mean to actually lead on digital. And it's not one thing, it's 14 things. And then what's the maturity curve, both from where providers are, where is the industry on what solutions they provide, and then how do we think about closing that gap? So we think about the power of convening to have the conversations to begin to close the gap, but with the underlying insight layer to figure out like what is the definition, right? My definition is probably different than your definition, and so I do think we'll see greater specificity, more emphasis on capabilities, and then how do industry companies, tech startups, and providers work more collaboratively together.
Nice. Now, Renee, you just got off the Vive 2023 stage where you were on there with Dan Mendelsohn from Morgan Health, I think that's right. And you were talking about employer expectations when it comes to healthcare costs and quality. Can you give us a little summary of that conversation?
I mean, Dan and I have deep respect for Dan's work at Morgan. We were chatting about the fact that most innovation in healthcare quality and cost have been driven by government entities.
Okay.
And there's been less focus commercially, and 150 million Americans get their health care in the US from commercial payers, and there's been not a ton of innovation. And so I think the challenge is, as healthcare spend becomes a major part of cost for employers and for employees, how do we think through getting greater strides, moving more quickly towards accountable care models that bring down the cost of care and improve quality, and then hopefully inflects health equity more broadly. So that was the conversation with Dan. They're doing some innovative work at Morgan where they're deploying both capital and different models to activate around that, and it was just fun to chat with them about how that could come to life.
And do you think we're at the point where we're going to take action on some of this? Because we've been doing a lot of talking about this stuff.
Yes. So going back, I do think when we talk to our members, this notion of how do I get to value is ever present. I agree with you, it's been slow moving. I think the capability building of what does it mean to be able to manage population health it's one of those things that says easy and does hard. And I do think there's much more of a conversation around that, especially given the disruption that we've been seeing. But the challenge here still is the economic model is mostly still driven towards fee-for-service, right? And generally, rational people follow models. And so I think I would say we're in the early innings of that.
Right.
Still, after many years.
After many years. But and to your point that you were talking about before, a lot of this change has been externally driven.
That's
but it's nice to start to hear that in your talk with Dan that maybe it's starting to be internally driven now.
And I think the force on that will be consumer expectations.
Right.
As a major driver and accelerator, and I think employers are increasingly thinking through, can I go direct to providers? Can I sort of compress the middle a bit?
Right.
Middle being payers or PBMs or other forces that are in play there, and really get to greater efficiency faster. And so I think that is a good conversation for us to continue to push on.
And frankly, to deliver what their employees want anyway.
Absolutely,
right?
Which is
experience.
Easier, more efficient, more affordable, frictionless. Yes, all of the above.
So we're kind of at the very start of the 2023 conference season.
Yes.
And the Health Management Academy does a lot of really amazing events. What do you have in store, and how are you going to be bringing together health systems and the health IT community?
Yes, so we do 65 events a year.
Right.
We've done 5 so far this year. So I'm getting, my roller bag will be in constant play here. The way that we try to think about it is in 2 ways. One is, who are the audiences that we should bring together? So we have a heavy emphasis on chief information officers, CEOs, CFOs, really every major constituency, we have a forum for that. We also increasingly are trying to think through ways to activate around topics. So we've got a consumer collaborative that we've launched. We have an AI collaborative with Microsoft, which will include Nuance, which is now a merged entity. We just announced today on this stage a big partnership with AWS on a technology fellowship. And so we will continue to go role by role and really tap into what's the conversation that CFOs or CIOs ought to be having. And then topic-based, how do you bring together stakeholders from across the ecosystem to find ways to drive health forward through these conversations that we really hope to curate well.
Now, you also have a podcast that you're doing.
I do.
And the latest season's coming out soon, I hear, right?
It is. In April, we'll be getting I think it's the 3rd season launched. And every year, we spend some time on what conversations do we want to have. And so I think for this season, we will continue to anchor on the themes that we're hearing from across our membership and what matters. A lot of focus on workforce, continuing to push on innovative models to really solve some of the workforce issues that feel a little bit systemic at this point.
Right.
We'll talk a lot about leadership, like how do we think about the mindsets of successful CEOs and their executive teams. We'll talk about how do we get to value and affordability more effectively. And we're always crowdsourcing for interesting people. The concept behind the table was to bring to bear both voices that you've heard and folks that you haven't. And so if anyone has an idea of interesting people that they feel like may have a point of view, we'd love to hear from them.
Nice. Where can people go, Renee, to find out more information about the Health Management Academy?
We're very easy to find, www.hmacademy.com. And we live on the power of pulling communities together. And so we'd love to meet new people and figure out ways to do that. So we'd certainly welcome conversation.
And where can people go to get to the podcast?
Anywhere that you listen to podcasts, we can be found. So your platform of choice, you can find us.
Awesome. Renee, thank you so much for being on our program.
Thank you.
Appreciate all the information.
Thank you. It was a pleasure. Appreciate it.
Hey, if you enjoyed this interview as much as I enjoyed being part of it, we'd love for you to subscribe, rate, and give us a review wherever you're listening and watching this. Plus, head on over to healthcareittoday.com for the latest news and insights. I'm Colin Hung for Healthcare IT Today. Thanks for being here.